Hello, I am your nurse today. My name is Nurse Nelda, and I am here to look at your eyes, your ears, your nose, your mouth. Is that all right?
No. Just kidding. Yes, it is.
All right, I'm going to wash my hands first, washing my hands. And now we will start with your nose. So I'm going to look at your nose. I'm going to palpate the nose. My inspection is good, symmetrical, everything looks good. Do you breathe okay out of your nose?
Yes.
Okay. I would inspect the nares, and but no, everything looks fine. I don't see any deviated septum, so everything looks good. Nasolabial folds, remember, are these areas that go from the nose to the corner of the mouth, and that looks fine. No bleeding. Do you have nosebleeds, anything like that? Okay, perfect. So now I'm going to have you close your eyes, and I have this potion that I'm going to ask you to smell. Smell it. Can you tell me what it is?
Alcohol.
That is correct. Very good. So that is your cranial nerve 1 test, your olfactory. You passed that. If you did not smell anything, that's called anosmia, but you did smell the alcohol, so that's good. So now I'm going to palpate your maxillary and frontal sinuses. So up here, is that painful?
No.
Okay. So now I'm going to use my pen light, and I am going to change it into a pen light. And I'm going to have you open your mouth. And do you have any problems with your mouth? Everything looks good. Okay. The mucosa looked good. I could see the soft palate, the hard palate, everything looked good. So now we're going to check cranial nerve 9, which is the glossopharyngeal nerve. And I'm going to have you open your mouth again and say ah, ah, and the uvula rises, and so that's what we want to see. I'm not going to check cranial nerve 10, which is the vagus nerve, which is a gag reflex. I'm going to save that for later. So then I stick out your tongue, inspecting the tongue for any papules, anything like that. Your frenulum on the, stick your tongue out, okay. Very good. And then move your tongue from side to side. Okay, that's perfect. So that is the end of that assessment. The documentation might read that denies nasal discharge, eyelashes and eyelids are negative for lesions. There's no, sorry, went back, got ahead of myself. Well, no, that's true, that's true. Frontal and maxillary sinuses are not tender, etc. All right, so now we're going to do the eyes, the eye assessment. So I'm going to inspect and palpate the eyebrows for texture. Everything looks good. Eyelids look good. Eyelashes look good. Very pretty. I'm going to pull down her bottom eyelid and look at her conjunctiva, and it looks good. I'm going to open this way. I'd be doing it more, but anyway, I'm giving you all an example. And it looks fine. It's red. Her sclera is clear. I don't see any jaundice, which is yellowing, remember. So now I'm going to use my pen light again. And I'm going to, again, check, and I'm going to look at the pupil. And so I'm shining the light away. Look at me. All right, I'm moving the pen light away and back, the pen light away and back, and her pupils would dilate and then constrict. And so and then follow my pen. Can you see that all right? So remember, accommodation is when it changes from far to close, but the vision is able to adjust and see it. So the documentation is Perla, pupils equal, round, reactive to light, and accommodation. Those are that test cranial nerve 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens. All right. The next thing we're going to do is we're going to test the extraocular muscles. So remember, the corneal light reflex is when I shine the pen light into the patient's eyes, and it tests for strabismus. The light of the pen light should be on the same location on both eyes. So and hers would be. You want to make sure that you're looking at where the light reflects on the cornea of each eye. The next thing we're going to do is look at the cover test for ocular alignment. And so I would cover one of her eyes right here and move it away, and there's no movement in her eye for either one. It's the same. Generally, if you remember in the textbook, if there's a problem with the eye, then it relaxes when it's covered, and then when you take it away, the eye goes back to focusing on the object. Now what I'm going to do is test the 6 cardinal fields of vision. So follow my pen. So we go up. I'm doing the middle, and then out here. Okay, good. Now we're going to check for visual acuity with the Snellen chart. So I'll give you this. So we go over, the person stands 20 feet away from the Snellen chart. So we go over here, and I'm going to start at this line right here. I'll point and cover one eye. So can you read that letter?
LPED.
Good. What about this one?
PECFD. EDFCZP. FELOPZD. DEFPOTEC. Okay, that's good. So that's 20/20 in that eye. That means that she is seeing well. 20/20 is good vision. All right, now cover the other eye. Let's start here. PECFD. EDFCZP. FELOPZD. DEFPOTEC.
Good. All right, so again, 20/20. And while I was watching her to see if she was squinting or leaning over, because any of those things would indicate that she was not seeing clearly. All right, the next thing we're going to do is use the ophthalmoscope. We're going to look at the red reflex of the eye. So I'm not going to get really close to her, but what you would do is you take the ophthalmoscope, you turn it on, and you can see you have the light right there. So you start out at an angle at about 15 degrees to the side, and I'll do it from this way. And so I'm looking through, and you keep going in close until, and there. I can see the red reflex from there in her eye. And we'll go to the other side and do the same thing. Okay, and I can see it from there as well. Not being able to see the red reflex would indicate cataracts or maybe some other situation going on with the eye. So that's it for the eye assessment. Do you have trouble seeing?
No.
Okay. So, so you would document denies blurred vision, denies pain, pupils equal reactive to light and accommodation, PERLA. And then vision 20/20, and you check it in each eye. So she has 20/20 in the right eye and 20/20 in the left eye. All right, the next thing is the ear assessment. So we're going to inspect and palpate the ears. So looking at the helix, remember there was a picture about Darwin's tubercle up here, and she doesn't have that on each side. So do you have any problems with your ears?
No.
Okay. Let's see. So what we're going to do first is the whisper test. That test, cranial nerve 8. So I'm going to have you plug your ear, and I'm going to whisper something.
Gray curtain. Snow cone.
Okay, very good. Very good. Now the next test we're going to do is the Weber test, and that test for that she can hear on both sides. So you have a tuning fork, and I'm going to stand behind her, and I'm going to hit my tuning fork. I'm going to place it on the top of her head like this, and then you're going to tell me that if you can hear it in both sides, okay?
Yes.
Okay, that's good. And when you hit the tuning fork, you kind of just have to do it with a flick of a wrist like that. So that's good. The next thing we're going to do is the Renee test, and that looks at air conduction versus bone conduction. So air conduction, when I'm testing her, I'm going to activate the tuning fork, place it on her mastoid bone, and then you tell me when you cannot hear it anymore, and then I'll move it from there to in front of her ear, and then you tell me when you can't hear it anymore. And the air conduction should be twice as long over her ear that she can hear versus back here. And I would do that normally on both sides, but I'm only going to do it on one side. But normally you check both ears, okay? So I'll do it on this side, and I'm going to look at my watch.
Okay. Okay.
Okay, so that was about 2 to 1, so that is fine. If there was a problem and she did not hear, if it wasn't a 2 to 1 ratio, then that could mean that there was some kind of neurological problem. I don't think I mentioned when we did the Weber test that if she couldn't hear on both sides, then that could indicate that there was an obstruction in one of the ear canals. Or it also could mean some kind of sensory neural issue. But you passed, that's good. Yay. The next thing is the otoscope. So with an otoscope, you take the piece, you put it on here. You always change in between patients. And then you turn it on just like you turn on the ophthalmoscope. Remember, otoscope is ear, ophthalmoscope is eye. So you make sure that you can see the light, and then I'm not gonna get close, but you pull up and back on the ear, and then you go in and you go in at an angle, and then I would have my eye like that, but I'm not gonna get close. And then you look into the ear canal. And what you would expect to see is the cone of light, and the cone of light is a little light, and your textbook has a picture of it. At 5 o'clock, you'll see that cone of light in the right ear, and the left ear, it's at 7 o'clock. That cone of light is a landmark. It doesn't mean, it's not used to diagnose anything, it's just a landmark that you know where you're looking. So, for documentation, denies difficulty hearing. Do you have ringing in your ears? I didn't ask that.
No.
So, no tinnitus, that's the word for ringing in the ears. And hearing is normal. So that's it for this assessment on mouth, nose, eyes, and ears. Alrighty, that's it.